If you're over 50 and you've noticed that your erections aren't as reliable as they used to be, don't automatically assume it's simply because you're getting older. There are several systems involved, and one of the simplest things you can do in the next 60 seconds may help you understand your body's response better. Maybe you've noticed something changing. You still feel desire. You still think about intimacy. But your erections may not be as firm, as fast, or as reliable as they were 10 or 20 years ago. Sometimes they happen normally. Other times, they seem to disappear at the worst possible moment. If that sounds familiar, you may have told yourself, "I'm getting older. This is just part of aging." But here's what many men over 50 miss. An erection isn't controlled by one single switch in your body. It depends on communication between your brain, nerves, blood vessels, hormones, and emotions. And when even one part of that system isn't working as well as it should, sexual function can change. That's why today's simple 60-second pressure and massage technique is worth discussing. Not because it is a magic cure. It isn't. There is no single spot on your body that can guarantee an erection or permanently restore potency. Instead, think of this 1-minute practice as a way to explore relaxation, body awareness, and the connection between your nervous system and circulation. You may notice that your body responds differently when you're calm compared with when you're tense, distracted, or worried about performance. And that difference can teach you something important. Because if your blood vessels are healthy, your nerves are communicating properly, your stress is under control, and your health is strong, you're giving your body a much better foundation for sexual function. The answer can involve much more than desire. Circulation, nerve signals, stress response, sleep, medications, and metabolic health can all influence what happens. That is why a technique should be viewed as one piece of a larger picture, not as a replacement for medical care or healthy habits. If something has changed, persistent erection problems may sometimes be an early reason to look more closely at your cardiovascular health, medications, blood sugar, blood pressure, sleep, or stress. So, yes, we're going to talk about the 1-minute technique, but don't stop there. The bigger question is why it may feel different for different men, and what that response can reveal about the systems behind an erection. Before we talk about where to apply pressure, you need to understand what actually has to happen inside your body for an erection to occur. Think of an erection less like a simple switch and more like a traffic system. Your brain is the traffic controller. Your nerves are the communication network. Your blood vessels are the roads. And your blood is the traffic moving through those roads. For an erection to happen, all of these parts have to communicate and respond. It starts in the brain. Sexual thoughts, attraction, touch, memories, and emotions can send signals through the nervous system. Those signals travel through nerves toward the blood vessels supplying the penis. The vessels then need to relax and widen enough to allow more blood to flow into the erectile tissue. The blood also needs to remain there long enough to create and maintain firmness. Specialized tissue expands as it fills, while veins are compressed so blood doesn't simply flow straight back out. You can think of it like opening the entrance to a busy road while temporarily restricting the exit. When the system works properly, pressure builds. Now imagine that one part of the traffic system becomes damaged. If the roads are narrowed, traffic moves slowly. If the communication network is interrupted, the signals may not arrive properly. And if the traffic controller is distracted by stress, fear, or anxiety, the entire system can become less efficient. Healthy blood vessels matter, nerves matter, the brain matters, hormones can matter too. Testosterone, for example, plays an important role in sexual desire and other aspects of sexual function, although low testosterone is only one possible contributor to erection problems. Stress is another important piece. When you're worried about performance, your body can shift into a more alert state. That doesn't mean you're doing anything wrong. It's simply one of the ways the nervous system responds to pressure. For men over 50, changes in erection quality can sometimes appear before a person notices obvious symptoms from cardiovascular disease. The blood vessels involved in erections are relatively small, so problems with circulation may become noticeable there earlier in some men. That doesn't mean every erection problem signals heart disease, but persistent changes are worth discussing with a healthcare professional, particularly when other risk factors are present. So when you hear about a 1-minute pressure technique, keep this bigger picture in mind. You aren't dealing with one magic switch. You're dealing with a coordinated system involving the brain, nerves, blood vessels, hormones, and emotions. And when you understand that system, you can make much smarter decisions about your sexual health, instead of chasing quick fixes that promise more than they can deliver. And that leads to an important question. Can a 1-minute pressure technique actually change any of it? Now let's slow down for a moment, because this is where a lot of online health advice can become confusing. You may have heard claims that pressing or massaging one specific point on the body can instantly improve erections, increase testosterone, or even restore sexual potency. Those claims sound appealing, especially when you're looking for something simple you can try at home. But your body is more complicated than a single pressure point. A gentle massage or pressure technique may help some people relax. And relaxation matters, because your nervous system plays an important role in sexual response. When you're tense, worried, or focused intensely on whether an erection is happening, your body may not respond as easily. But there's an important difference between helping your body relax and treating erectile dysfunction. Research does not establish that pressing one specific point can permanently restore erectile function. A pressure technique cannot repair narrowed arteries, reverse diabetes, correct a medication side effect, or replace treatment for an underlying medical condition. So, if you've been struggling with erections for months, don't think of this technique as a substitute for finding the reason. Think of it more like one small piece of a much larger puzzle. And there is another reason I want you to approach this carefully. More pressure does not mean better results. You should never aggressively press, squeeze, or manipulate an area of your body because you believe stronger pressure will produce a stronger sexual response. A useful technique should feel comfortable, gentle, and controlled. If you experience significant pain, numbness, unusual tingling, dizziness, swelling, or another concerning symptom, stop. And if you have a medical condition or have recently had surgery or an injury, it's reasonable to ask your healthcare professional whether a particular massage technique is appropriate for you. Here's the myth worth remembering. The myth is that one pressure point can permanently restore potency. The reality is that erectile function depends on several systems working together. Blood vessels need to respond properly. Nerves need to communicate. The brain needs to send the right signals. Hormones can influence sexual function. And your emotional state can affect the entire process. So why discuss the technique at all? Because the surprising part may be that the technique itself isn't the most important thing. What may matter more is what happens immediately afterward. If a minute of gentle pressure and slow breathing helps you feel calmer, less distracted, or more connected with your body, that gives us a clue about another piece of the puzzle, your nervous system. And this is especially important for men who have experienced the frustrating cycle of one difficult sexual experience, followed by worry about whether it will happen again. That worry can become part of the problem. So before we go any further, let's look at what happens inside your body when stress takes over and why sometimes trying harder can actually make sexual response more difficult. That brings us to the part that may be more important than the point itself, your nervous system. Here's something many men don't realize. Sometimes, the biggest obstacle to a healthy sexual response isn't a lack of desire. It's what your nervous system is doing in the background. Imagine a 62-year-old man who has one difficult experience. Maybe he couldn't get fully hard, or he lost the erection before intimacy was finished. It happens once, and he feels embarrassed. The next time, instead of simply being present with his partner, part of his mind starts asking, is it going to happen again? That question may seem harmless, but now he's watching his body instead of enjoying the moment. He checks whether he's getting hard. He notices every small change. He worries about disappointing his partner. And the more he worries, the harder it can become to relax. This is where the mind and body become closely connected. When you feel threatened, anxious, or under pressure, your body can move toward a more alert state. Stress-related chemicals, such as adrenaline, prepare you to deal with a challenge. Your heart rate and attention can increase, while your body becomes less focused on functions that aren't immediately necessary for dealing with that perceived threat. Sexual arousal generally works better when the body can shift into a calmer state. Emotionally disconnected or afraid of being judged, your body may not respond the way you want it to. Poor sleep can make this even harder. When you're exhausted, stressed, and running on too little rest, your overall energy and sexual interest may suffer. This is why simply telling yourself to try harder isn't always helpful. An erection depends heavily on blood flow. During sexual arousal, blood vessels supplying the erectile tissue need to relax and allow significantly more blood to enter. The tissue then expands, helping maintain firmness. So, if the blood vessels aren't responding properly, the erection may become weaker, take longer to develop, or become more difficult to maintain. Here's something particularly important for men over 50. The arteries involved in erections are relatively small compared with many other major blood vessels. Because of that, changes in vascular function can sometimes become noticeable through erectile difficulties before a person develops obvious symptoms elsewhere. That does not mean every erection problem is a sign of heart disease, but it does mean persistent changes shouldn't automatically be dismissed as, "I'm just getting older." The good news is that these are not simply facts you have to accept. Many of the factors that influence vascular health can be improved. Walking more, staying physically active, managing blood pressure and blood sugar, avoiding tobacco, eating a balanced diet, sleeping well, and following appropriate medical treatment can all support cardiovascular health. And if you've noticed a persistent change in your erections, consider mentioning it to your healthcare professional. It can be an important opportunity to review blood pressure, cholesterol, blood sugar, medications, and overall cardiovascular risk. Your body may be giving you an early signal, not a reason to panic, but a reason to pay attention. So now, let's come back to the 1-minute technique and talk about how to approach it safely, without making the biggest mistake men often make with these methods, assuming that more pressure must mean better results. Now let's get practical. If you're interested in the 1-minute technique from this video, the most important thing is to approach it gently. This is not a treatment that guarantees an erection, and it isn't a replacement for medical care. Think of it as a short relaxation and body awareness routine that you can use without forcing your body to do anything. Start by getting comfortable. You can sit upright in a chair or stand in a relaxed position. Let your shoulders drop. Unclench your jaw. Take one slow, comfortable breath and allow your attention to move away from whatever was stressing you a few moments ago. For the next minute, the goal is not performance. That's important. Many men approach sexual health by constantly checking whether something is happening. Is it working yet? Am I getting harder? How quickly is this going to work? That mindset can create more tension, which is exactly what you don't want. Instead, use gentle, comfortable pressure or massage on the area being discussed. The pressure should never be painful. You don't need to push hard, squeeze aggressively, or try to force a sensation. There is no evidence that making the pressure stronger will make the sexual benefit stronger. As you do this, continue breathing slowly and comfortably. Notice your shoulders. Notice your jaw. Notice whether you're holding tension in your abdomen or elsewhere. You are simply giving your body about 60 seconds to become calmer and more aware. And here's a pattern interrupt that I want you to remember. Don't immediately test yourself afterward. You don't need to rush into checking whether you have an erection. Instead, ask a simpler question. Do I feel more relaxed than I did 1 minute ago? That is a much more useful observation. If you feel calmer, that's valuable. Relaxation may support a healthier sexual response for some people, particularly when stress or performance anxiety is part of the picture. But that doesn't mean the technique has repaired blood vessels, increased testosterone, or cured erectile dysfunction. And if you feel nothing different, that's okay too. Your body isn't a machine that produces the same response on command. One day you may be tired. Another day you may be stressed. Sleep, medications, alcohol, illness, relationship factors, and cardiovascular health can all influence sexual function. Most importantly, stop if the technique causes pain. Significant tingling, numbness, dizziness, swelling, or unusual discoloration. Gentle means gentle. The real purpose of this minute is to practice calmness rather than pressure. You're not forcing an erection. You're learning how your body feels when you slow down and remove some of the performance demand. And that distinction matters, because a simple technique can be useful without becoming a miracle cure. The goal is better awareness, not unrealistic expectations or instant results. And once you understand what this routine can realistically do, you can avoid another trap, believing every viral claim about pressure points. Let's slow down for a moment, because there is a lot of misinformation online about pressure points, testosterone, erections, and male potency. Myth number 1, Pressing one specific point can instantly increase testosterone. That sounds impressive, but there's no good evidence that pressing or massaging one area of the body can dramatically raise testosterone on demand. Gentle massage may help you relax, improve body awareness, or reduce tension, but that is very different from producing a major hormonal change. Myth number 2. The more pressure you use, the better the result. Absolutely not. More pressure does not automatically mean more benefit. Aggressive pressing can cause pain, bruising, irritation, or injury, especially around sensitive areas. If a technique feels sharp, painful, numb, or uncomfortable, stop. The goal should be relaxation, not forcing your body to respond. Myth number 3. If you're over 60, weak erections are inevitable. Aging can increase the likelihood of erectile difficulties, but persistent erectile problems are not simply something every older man has to accept. Changes in blood flow, medications, diabetes, cardiovascular health, stress, sleep, hormones, and other factors can all play a role. Myth number 4. If you can get an erection sometimes, there's no health issue. Erectile function can vary from one situation to another, and being able to get an erection occasionally does not automatically rule out contributing factors. Myth number 5. A massage or pressure point technique can replace medical treatment. It cannot. A relaxation technique may be a reasonable part of a healthy routine, but it should never be presented as a cure for erectile dysfunction. If the problem keeps happening, the better question is not simply, which pressure point should I press? But, what changed and why? Sometimes erectile difficulties are connected to conditions that deserve proper evaluation. And here's the surprising part. There's one mistake that matters much more than any pressure point waiting too long to investigate what changed. If your erections have changed after 50, the biggest mistake may not be what you're doing, it may be what you're not doing. Mistake number 1 is blaming everything on age. Yes, erections can change as you get older, but saying, I'm over 50, so this is normal, can cause you to overlook something treatable. Mistake number 2 is ignoring blood pressure and cholesterol. Healthy erections depend heavily on healthy blood vessels, so high blood pressure and unhealthy cholesterol levels can affect circulation throughout the body, including the blood vessels involved in erections. Mistake number 3 is avoiding physical activity. Regular movement can support cardiovascular fitness, circulation, metabolism, and overall energy, while prolonged sitting can work against those goals. Mistake number 4 is drinking too much alcohol. Frequent or excessive alcohol use can interfere with sexual performance, sleep, mood, blood pressure, and the nervous system. Mistake number 5 is ignoring medication side effects. Some medications can contribute to sexual difficulties, but you should never stop a prescribed medication on your own. Instead, tell your healthcare professional what has changed so they can determine whether a medication or another factor could be involved. Mistake number 6 is feeling embarrassed and refusing to discuss the problem. Imagine a man who notices that his erections aren't as reliable as they used to be, tells himself it's just aging, and then allows months or even years to pass without discussing it or checking whether blood pressure, cholesterol, medications, lifestyle, or another health factor could be involved. That doesn't mean something serious is definitely happening. It means he missed an opportunity to investigate. The good news is that several of these factors are changeable. You don't need to feel ashamed, and one difficult experience doesn't mean something is permanently wrong. The smarter approach is to notice the pattern, address the basics, and seek appropriate medical guidance when the change persists. But before you try to fix anything at home, there are certain symptoms you should never simply massage away. Before we talk about what you can improve at home, don't skip this section. Most changes in erectile function are not automatically an emergency, but persistent or unusual changes can sometimes point to an underlying health issue that deserves proper evaluation. If erections become noticeably weaker, disappear consistently, or the problem continues instead of improving, don't simply assume it's aging. Also, pay attention to cardiovascular symptoms. If erectile difficulties occur alongside chest pain, unusual shortness of breath, dizziness, or significant symptoms during physical exertion, that should be discussed with a healthcare professional promptly. You should also pay attention if you have major cardiovascular risk factors, such as high blood pressure, high cholesterol, diabetes, smoking, or a history of heart or blood vessel disease. These don't automatically mean your erection problem is caused by your heart, but they make a proper health assessment more important. New neurological symptoms, such as numbness, weakness, difficulty with coordination, or other neurological changes alongside sexual problems, also deserve medical attention. If erectile changes follow a pelvic injury or you experience significant pain, don't try to solve the problem by repeatedly applying pressure or massage. Persistent penile pain, a new or worsening curvature, a lump, or another noticeable physical change should also be evaluated rather than treated yourself. If symptoms started after beginning or changing a medication, tell your doctor or pharmacist, and never stop a prescribed medicine without professional guidance. Also, pay attention to symptoms that could suggest uncontrolled blood sugar or blood pressure problems, particularly if you haven't had these checked recently. Finally, a significant loss of libido, combined with other symptoms such as unusual fatigue, mood changes, or other physical changes, may also be worth discussing with a healthcare professional. The key message is simple. Don't panic, but don't dismiss persistent changes either. An erection problem doesn't automatically mean something dangerous is happening, but your body is giving you information. And sometimes the smartest response is to investigate rather than guess. If serious warning signs aren't present, the next question is, what can you actually improve every day? Now let's move away from quick fixes and focus on what actually supports sexual health over time. Think of the 1-minute technique as the small front door. It may give you a simple moment to slow down, relax, and become more aware of your body, but cardiovascular and metabolic health are the foundation of the house. If you want better sexual health after 50, these 5 foundations deserve your attention. First is movement. Regular walking is simple, accessible, and beneficial for overall cardiovascular health. And depending on your abilities, you can also include strength training and other forms of cardiovascular activity. Don't underestimate prolonged sitting either. If you spend most of the day sitting, get up regularly, walk around, stretch, and give your body opportunities to move. Second is blood pressure. High blood pressure can damage blood vessels over time, which is one reason monitoring it matters. If you've been diagnosed with hypertension, follow the treatment plan recommended by your healthcare professional. And don't wait until you feel something because high blood pressure often doesn't cause obvious symptoms. Third is blood sugar. Your everyday eating pattern matters, so reducing excessive added sugar, choosing a balanced diet, and maintaining a healthy body weight can support overall metabolic health. If you've had abnormal blood sugar readings, don't ignore them. Discuss them with a qualified clinician and follow the recommended testing or treatment plan. Fourth is sleep. Aim for a consistent sleep schedule and give your body enough opportunity to recover. If you regularly snore loudly, wake up gasping, feel unusually tired during the day, or suspect that your sleep isn't restorative, bring it up with a healthcare professional. Fifth is smoking and alcohol. If you smoke, quitting is one of the most valuable things you can do for your vascular health. And if you drink alcohol, keeping consumption moderate or avoiding it altogether may be beneficial, particularly if alcohol is affecting sleep, blood pressure, weight, or sexual performance. You don't have to completely transform your life overnight. Start with one foundation, improve it, make it consistent, and then build from there. Imagine where you could be 6 months from now if you walked more, monitored your blood pressure, paid attention to blood sugar, improved your sleep, and addressed smoking or excessive alcohol. Small decisions repeated consistently can create very different outcomes. And there's one factor here that many men underestimate because it's often hiding in plain sight: the medications you take every day. Now, we get to an area many men overlook: the hidden contributors. If your erections have changed, don't automatically assume it's psychological, and don't automatically blame aging. Sometimes the explanation may be found in something you're already taking or in another health factor that hasn't been evaluated yet. Some medications can affect sexual function. Certain blood pressure medications may contribute to erectile difficulties in some people, and some antidepressants can also affect sexual response, libido, or the ability to reach orgasm. Other prescription medications may influence sexual function as well. But here's something extremely important. Never stop a prescription medication on your own because you think it might be affecting your erections. Stopping medication suddenly can create its own health risks, and the medication may not actually be the cause. Instead, have a conversation with your doctor. Tell them when the sexual changes began, what medications you're taking, whether any medication was recently started or changed, and whether you've noticed other symptoms. Sometimes a clinician may determine that a medication is contributing, while in other situations, they may find another explanation entirely. Hormones can also enter the conversation. Low testosterone is possible, but it should not simply be assumed. Feeling tired, having lower libido, or experiencing erection difficulties doesn't automatically mean your testosterone is low. Testosterone levels can vary, and proper evaluation may involve symptoms, medical history, and appropriate testing rather than guessing from one symptom. That's why online supplements and quick hormone claims can be misleading. You may not need a stronger supplement, you may need a better conversation with your doctor. That conversation can help determine whether your medications need review, whether certain health conditions should be checked, and whether hormone testing or another type of evaluation is actually appropriate. Instead of thinking, something is wrong with me and I just have to live with it, you can start thinking, there may be several possible explanations and I can investigate them. The goal isn't to chase one magic pressure point, supplement, or hormone. The goal is to understand what your body is telling you and address the factors that can actually be changed. Now, let's put everything together into a realistic routine you could actually follow. So, let's bring everything together. If you've noticed changes in your erections, don't panic over one bad experience. Stress, fatigue, poor sleep, alcohol, medications, and many other temporary factors can affect sexual performance. But don't make the opposite mistake and dismiss persistent changes as just getting older. Erectile function depends on a complex combination of blood flow, nerves, the brain, hormones, emotional health, and overall physical health, which is why there usually isn't one magic pressure point that can fix everything. If you choose to try the gentle 60-second routine we discussed, think of it as a simple relaxation and body awareness practice, not a guaranteed treatment for erectile dysfunction. Remember, more pressure does not mean better results. Keep everything gentle, and if something causes pain, numbness, bruising, or significant discomfort, stop. The bigger goal is much more important. Pay attention to your circulation, physical activity, sleep, stress, blood pressure, blood sugar, smoking, alcohol use, and medications. Because these foundations can have a much greater impact on your long-term sexual health than any viral internet technique. And if erectile changes continue, become significant, or appear alongside warning signs, don't be embarrassed to seek professional medical advice. Your health is worth that conversation. Getting older does not mean becoming powerless over your health. You may not be able to control every change that comes with age, but you can control many of the choices you make and whether you pay attention when your body tells you something has changed. If this video was useful, give it a like and subscribe for more practical men's health education. And tell me in the comments, what men's health topic would you like me to explain next? Remember, your age is a number, not a reason to stop caring for yourself. Take care of your body, listen to the signals it gives you, and keep moving forward.